Hi, good evening. I'm Dr. Min from Taiwan. Today, I'm very happy to be here to share you my topic. A plastic surgeon could be an inventor. First of all, let me introduce myself. I'm Dr. Ling from Taiwan, and I'm a board certificate plastic surgeon from Taiwan, also a member of TSAP, TSPS, ASAPS, ISAPS, and the Express. This is my disclosure. I'm the director of Charming Institute of Aesthetic and Regenerative Surgery, CIRS, and also the inventor of KêNH and the scientific advisor of Dermatoplastic Beauty, Taiwan. I received my royalty for my DVD and the upcoming textbook. And this is my personal line and overview. Are welcome to share any experience or have your question with me through my contact strategy. And how did it start? For this presentation, I'm going to start with all of you. 128 years ago, a German surgeon, Gustav Adolf Neuber. He was the first report on fat autografting in human in 1893. However, I must point out there are some steps in fat grafting. First of all, like we have to harvest the fat. So we use some like a liposuction machine, or we use the maneuver to insert some suction cannula, then to harvest with fat by some negative pressure. Then we refine all this fat with some sieve method or some so-called gouge method, or we put it on the centrifugation machine to purify the lipo aspect. And finally, we transplant with our hand using the 1cc syringe to put on wherever we need to put some fat to restore the volume. Actually, there are some so-called ratchet gun commercially to put the fat into our body. And we noted that there are so many commercial injection cannula. However, the tail of the cannula is something manufactured with Durac surface. And we use the Durac syringe to make connection like this. So we can push whatever material like fat with our hand without disconnecting of these two-part syringe and the injection cannula. However, clinically, you are easy to find this so-called loose slip cannula. And the loose slip is the only way to put into the injection cannula into the tail, but not something like I mentioned earlier to have this lock. So this is very common things. It's much cheaper and available, and this lock type is a little bit expensive, but it's not so commonly seen and not commonly available in any hospital or clinical. We know that Plato said, necessity is the mother of invention. So earlier, maybe 15, 16 years ago, I myself just thinking about if I have something like this, there should be a depression caused by a cannula or some there is a very simple pixie device like this, and through this apparatus we can apply the so-called barrel flange of a syringe to lock in this device. Then the head have a lock carving inside the cannula. Then we can put the lock injection cannula like this to make these two parts safely connected, and we can use this one to deliver the fat like this. And you can see that it's much easier, user-friendly for you to hold in with your fingers, and you can carefully to deliver one little parcel by one little parcel. However, this pixie device for the lipo feeding, you might see that there is some inconvenience using the loose slip, because when you using the loose slip, as we mentioned earlier, it's only to go into, not connected to the injection cannula safely, and there's always slippery manner when you inject the fat, and somehow and sometimes there's going to be often disconnection when you push the fat or push the plunger of the syringe. So this pixie device was a user-friendly device. However, about the accuracy of each injection, while we withdraw the apparatus, as you can see in our previous video, it seems that it's hardly to push each parcel at 1/30 to 1/50 when you withdraw the cannula, as the modern father or fat grafting Dr. Sidney Coleman suggests. So at this point, what can we do? Is there something new or new technique or invention which will facilitate or guarantee our delivering the fat at such tiny parcel, precise and consistent? So actually we have an preliminary tool, but how we go from this simple, easy pixie device to the prototype of the map gun. There is a story that I must tell you. Actually, I think most of you are medical related staff, like medical student, like a residency, or surgeons or physicians in your clinical. We know that they are so-called the evidence-based medicine. That means the conscientiously is proceed the judicious use of current best evidence in making decisions about the care of individual patients. And it is not restricted to the random trial or meta-analysis. It involves tracking down the best external evidence with which to answer our clinical questions. So there are two mentors that I have to mention. The father of modern fat grafting, Dr. Stanley Coleman, and his concept of structural fat grafting. And another giant mentor of myself is Dr. K from Brazil. Dr. K mentioned in 1993 that the grafted of all group in his study was surrounded by a collagen capsule, and the viable tissue was observed in the peripheral zone, approximately 1.5 plus minus 0.5 millimeter from the edge of the graft. That this slide showing us the central will not survive, only the peripheral zone 1 to 2 millimeter in width we are going to survive with 40%. Next year, he also present that the maximum percentage is about 40% when the graft is no greater than 3.0 millimeter thick, meaning that either your transplanted parcel in spherical or cylinder shape that's going to have peripheral survive, but not in the central necrotic area. So I myself in 2006 just thinking that the hypothesis that if the fat parcel is small enough, we can decrease the central necrosis and keep it as low as possible, and moreover, the potential complication related to central necrosis, such as fibrosis, abscess or cyst formation, nodulation, calcification, or surface irregularity might be avoided. So the ideal radius is 1 to 2 millimeter. And by the mathematical calculations, the spherical parcel volume is equal 4 by 3 cross pi cross radius, which is the radius of a spherical cubic. So through this calculation, we all know that the radius is 1, the volume should be 4.2, and they are going to be 240 parcel calculated by 1 cc equal to 1,000 millimeter cubic divided by a radius 1 to 4.2 millimeter parcel. Likewise, if the radius is 2, they are going to be 30 parcel in 1 cc. So for a higher survival rate of fat grafting, the injection frequency of 1 cc fat should be at least 30 times. So the Dr. Sidney Coleman, father of modern fat grafting, also evoluted from the earlier 1993, 4, and 95 all the way to 2006. He insisted using a 1 cc syringe with the cannula around 18 gauge brown tip one side hole, and each parcel should be in between 1/30th to 1/50th. Finally, based on the so-called evidence-based medicine, I have Imafgan. And as you can see that Imafgan is quite easy for you to only simply pulling the trigger of this instrument, and all the parcel with each volume will equally divide, because the advance of the plunger is fixed distance, and not with the fixed and consistent volume will be delivered. So the conceptualization of micro autologous fat transplantation begins from my invention, Mefgang. And as we know, earlier time in 19th century, we used bell telephone, and this year there's going to be a very updated cell phone. So from the very beginning of the evolution of a telephone, we know that the Mefgang actually come to the marketing in 2010, first generation and second generation, and nowadays we have the so-called update generation 3 Mefgang. And let me showing you with this video, and it illustrated how we use the Mefgang to deliver the fat. Actually, it allows any surgeon to predetermine their volume according to different location of your grafting area, like in the face or in some other area. And also, it is a very quick, easy connect chuck, which allows you to connect your cannula. And it is a septic bottle, allowed you to back pull in the plunger pusher. Then spare the air with your fat. Then you will see here is at each volume of 1/60th and 1/90th, it is much smaller. And you can see that when you withdraw the Mefgang, you're keeping delivering by pushing the trigger, and you can achieve the different size of each parcel. And normally in the face, I always keep 1/120, and some delicate area, even I keep 1/240 in the so-called the periorbital area of my operation. So you can see from this slide, this is the variable size of parcel from 1/10, 1/30, 1/60 to 1/240, and the right side 1/60 to 1/240 is actually a scientific technique by Mefgang, and accurate, precise, and consistent. How does MEF play a scientific role in fat grafting now and in the future? Early in 2007, I first proposed the concept of microautogous fat transplantation, and through the year, we get patents from Taiwan, Korea, Japan, US, and EU. We also manufacture this instrument, MAFGAN, and the mobile kit through the certification of GMP and ISO CE marking, and of course US FDA. We also perform many preliminary animal studies and concluded that almost over 80% of human fat grafting survive in new mice model, which specifically all this survived fat grafting express unique human origin. And about the math publication, since 2012, we present our concept in East Press. Then we do many, as mentioned earlier, in animal study and cadaver dissection courses. And of course, we have many articles published, like in PRS 2014 and Anal-Plastic Surgeon 2016, focusing on how I recontour the sunken upper eyelid and recreation a naturally double eyelid crease, which many Asian people ask for. In this case, you can see this is the pre-sunken eye with multiple fold. This is 1 year after. Quarter view. Another case, sunken eye with no double eyelid crease, and this is 2 years follow-up. Close-up view, pre and post. We also further extend the use not only in some area of the face, but also the so-called total facial rejuvenation with MAFT technique. And as you can see, this case from forehead, from temple, from sunken eye, and nasal root, teardrop, digit junction, nasolabial area, and mental area, chin augmentation with fat grafting. And this is, you can see 1 year's follow-up, looking down close-up view and smiling view. Talking about the nasal dorsum, many Asians want to be elongated and increase the height. We also report in a very high-ranking journal, Aesthetic Surgery Journal in 2016, and in Journal Craniofacial Surgery 2017, we highlight and demonstrate a technique of how I using the MAFGAN with fat grafting to recontour the depressed temple area. For this case, 2 times of MAFT, you can see that the dorsum height and the length. Lateral view, you can see the increased area, and even the nasal tip projection is a little bit lowering down, and this is close-up view. You can see the definition of nasal dorsum is much expressed after twice after fat grafting. And this is almost actually a total facial rejuvenation. Another case 6 months after. Of course, when you encounter such case, you might suggest patient to receive a second touch-up area, especially in the sunken temple area. In this case, again, 1 year and 6 months, the contouring of the temple, and again, we can see that all the area, including the forehead and the aging dorsal hand, we also reported the technique and the relative strategy for that. You can see this is forehead rejuvenation, and this is 2 years follow-up pre and post, looking down close-up view. And you can see this is a pre-aging with obvious tendon and dorsal vein exposed and very thinning of the dorsal hand skin. And this is 3 years after, another hand. And you can see this is pre and 1 year follow-up, another case 1 year follow-up. So actually all these mentors from Dr. Sidney Coleman, Dr. Carpenter, and further the concept of math is further demonstrated and certificated by the Dr. Yoshimura from Tokyo and Dr. Rory from the Miami. So the central dogma of MEFCON is concentrate on deliver precisely, accurately, and consistently from 1/60 milliliter for like in the hand or the neck area, all the way to 120 in the face mostly, and in the periorbital 1/240 milliliter per pascal. So it is a promising technique with reliable instrument and also help decreasing the potential morbidities and assure the consistency and the repeatability. Since 2007 till now, I personally performed more than 2,500 cases of facial fat grafting and more than 300 cases for body contouring, including breast augmentation and the buttock augmentation with the MEFCON. Let me introduce you briefly the MEFT technique, which is an abbreviation of micro-autologous fat transplantation. Normally, I manually dipole aspirate using a 10 cc syringe with back pulling 2 to 3 out of 10 milliliter syringe to keep the negative pressure about 300 millimeter mercury. Then I centrifugate at 3000 RPM for 3 minutes, which is almost reached to 1200 G-force. Then I condense the lipo aspect to get the purified fat and transfer to 1 cc of dual slip regular syringe, then loading to MEFCON. And more cases to share with you. And this is a case for the chin augmentation. As you can see, some mentalis strand in this young lady with irregularity of the chin area. And this is 8 months after. This is 8 months after. From profile lateral view, you can see this is a little bit not full protrude chin, end up with 8 months after one section of fat grafting. And again, this is a case with a rounded, which is not useful looking And after one section of fat grafting, profile view, lateral view we can see, and spanning view with the fullness of the chin. And about the cheek, in this case, you can see this is 2 years after the depressed of chin with more fullness and more shining and more moisturizing of fat grafting in the chin area. And in earlobe or some headaches, you can see this in the earlobe, more fullness, and all the way headaches area much soft and fullness. And some aging of headaches or earlobe with fine wrinkle end up 1 year after fat grafting. Of course, in the upper or lower lip, you can see this vertical line dryness of the upper and lower lip, end up with more fullness, with moisturizing, and less wrinkle, vertically things. You can see this fullness after 2 years, one section of lip augmentation. As I mentioned to you, in a year, doesn't increase the height and length. Actually, this is a congenital deviation of the nasal dorsum, maybe due to some defect or deformity in the nasal septum. However, we use a very easy and comfortable fast recover fat grafting over the nasal dorsum, and you can see the dorsum become more straight. And from the looking down view, you can see the inverted S shape become much straight. And you can see this is a deviation of the nasal dorsum, grossly become much straight. And also this is a paper appear in the Aesthetic Surgery Journal, which is the top ranking one in Aesthetic Journal. About the sunken eye, we published in 2014, and we highlight the technique on how I recontour the sunken eye. Actually, I will plan preoperatively zone 1, zone 2, and zone 3. And in the zone 1 full layer, zone 2 just superficially to connect with the zone 1. End up with this case, you can see this is immediately after surgery, and you can see the multiple fold with sunken eye in complete improve immediate after surgery, and follow up in 6 months. You can see this is a very nicely recontour with satisfaction. Another case, close-up AP view, 4-year follow-up, and all the detailed technique is highlighted in the anaplastic surgery. And actually, the fat grafting changed myself in my plastic surgeon career quite a lot. For example, when we deal with the teardrop and electric junction, with some aging eye bag, you can see that we always want to do some skin excision with muscle removal, no muscle remove. We are taking care of the orbital fat with redraping or reposition, and apply some combined adjunctive procedure like ligament releasing or cancelotomy or some of the other. All we want to do is a total rejuvenation of lower eyelid. However, there are so many complicated procedures and steps which we have to learn, and end up with we could not find a very unique and very good, suitable and flexible strategy for all these problems. So I just concentrate and propose the so-called simple 3 steps for aging no eyelid with skin excision and remove orbital fat and doing fat grafting with the technique of MAFT. No releasing, no any complicated procedure, and as we know, the more procedure you do, the more swelling and the more possibility of post-operative ectropion will occur. So in this aging eyelid, you can see this is pre and post 1 year's close-up quarter view, nicely recontoured without any visible scar or any other complication like ectropion. And you can see this 1 year after. Another case, 5 years after. And another case, 1 year's follow-up. You can see the fine wrinkle, dark circle, baggy-eyed, and all these aging appearance, including the skin dermatochalasis, redundancy, or the skin texture, all improve after 1 section of so-called simple 3-step low-grade blepharoplasty. And another case, 1 year's follow-up, quarter view, smiling view. Of course, with the extension to some so-called mid-cheek area and crossfit, you can achieve a very nice rejuvenating effect like this case showing us. And you can see the wrinkles are improved. So we summarize and we also conclude all the other like Rohrisch group, Rohrisch group, 5-step, 7 changes, or 6 steps for all these aging no eyelid end up with our concept, or only 3 steps in step 1, skin excision, and step 2, remove the orbital fat, and step 3, inject the fat. And we are lucky and honorable to be published in the first article in 2019 November in Aesthetic Surgery Journal. Of course, in doing some baggy eyelid without skin redundancy, we can adopt a so-called transconjunctival approach to remove the fat, and we inject fat grafting again. And in the infraorbital dark circle, like this lady showing us, not only dark circle with a little bit skin redundancy and teardrop and liquid junction deformity and the baggy eyelid, you can see only fat grafting. This is 1 year and 6 months follow-up, almost 3 years follow-up. About the facial scar, you can see this is acne scar after 1 section, 2 years follow-up. It's a very satisfactory result. And the traumatic scar with soft tissue depressed and the obvious scar, and this is 6 months after, and this is close-up 6 months after. About the hemifacial microsomal congenital anomaly, you can change from a very complicated like a muscle flip-flop to a very easy method technique, which is take you only maybe 30 or 40 minutes to complete all the camouflage to recontour the deficient soft tissue. Pre and post. About the coming smile, as we know, the definition is the exposure of 2 to 3 of the gum while smiling. So there are so many etiology like skeleton, gingiva, muscle etiology, or even some iatrogenic. My delivered fat to the nasolabial fold, ego tri and upper lip. You can completely recover and have a very, very good result in these cases. And to our knowledge, this is the first report of autologous fat grafting for gummy smile. And again, we publish in Aesthetic Surgery Journal. Early in 1895, 2 years after the first reported by Dr. Gustav Adolf Neuber, a German surgeon first attempt to enhance a woman's breast with implantation of a lumbar lipoma, which is nowadays regarded initially fat grafting to the breast. And in 2017, we launched the MEFGAN 10cc type. And in this video, you can see that when you apply the 10cc type of MEFGAN, you can deliver the fat grafting to the breast quite easy and consistently as you do the fat grafting to the face. Some cases, this is actually some touch-up fat grafting to enhance a yoga tutor to be nicely dressed in his job. And you can see this only 100 milliliter fat grafting to the breast. And actually for me, one section is going to increase the breast cup at about 1 size. So this is 4 months after one section. Some case might feel good enough. So this is one section. Actually, this is again 8 months after one section of breast. And the right side is increased more than left side. End up with some symmetry of both breasts. 8 months. Some case wish to have more enhancement. So this is a case which I am showing you earlier, 4 months after one section of MAP, and this is 6 months after 2 sections of MAP. And you can see after 2 sections, 6 months, pre and post. And actually, this case want to have a more enhancement with all the fat tissue from herself. And this is after 2 sections. And this fat is harvested by the water jet, which is much suitable for the fast recovery from the patient side, and there's painful sensation after fat grafting. You can see after 2 sections, 1 year, 2 sections. And how about the long term? Actually, this is 8 years after one section. One section after the fat grafting. One section. This is 4 months after one section, and I do the second touch up. So this is after 2 sections of MAP, 7 years. 1 after 2 sections, 7 years. 2 sections after 7 years, long-term follow-up. But nowadays, I think many cases over than 16, actually is a case in her age of 62, 2 sections of fat grafting. And you can see much fullness with a very nature, recontouring and rejuvenation of her breast. And this is when patient jump is quite nature movement of her breast. And in the MRI image, either in T1 or T2 edit, they are so homogeneous image showing you most of the size contributes from the fat graft. So in conclusion, the valueness of the MAP technique and the MAP gun, an innovative instruments, actually originates from the concept of all these mentals. And all these concepts and principles are totally executed by MAP. And again, we know that MAP gun are promising and reliable instrument, assure the consistency and decrease the mobilities. So I want to echo all these lessons pointed by Dr. Newber, and in English is the smaller the little pieces, the sure is the success. However, we are in the process of perfecting our craftsmanship, but we had yet to be an artist. And since 2007, the MAP gun, and since 2011, we start to advocate our concept through many of MAP symposium, and all these doctors learn and share with each other a wonderful experience from domestic in Taiwan and internationally from all over the world. And I think many participants will feel very informative and good response in their career afterwards. So we have many symposium and a webinar, and all of you are welcome to join. And this is the QR code of all our documentation, like our publication or our information for the map of our symposium and the webinar through the internet. So I think the MAP gun and bring Taiwan to all over the world, and we not only share with our technique, we communicate with many doctors from all over the world, like Lord Rorish, like the editor-in-chief, and I myself was the editorial board or aesthetic plastic surgery. And as mentioned, we have many publications to be in the editor-in-chief for the Nanhai Aesthetic Surgery Journal. And nowadays in Taiwan, almost every hospital, medical center have the MAP gun. And most doctors in Taiwan use the MAP gun to inject fat. Of course, we cannot change our past. However, I see that we can do something to change and shaping our future. And during this pandemic, COVID-19, I hope all of you stay safe and healthy, and Taiwan can help. Taiwan is helping. For years, I have ever been to Vietnam for many times, and I would like to thank our research team Dr. John. Actually, he is from Hanoi, Vietnam. So I would like to share with you and Vietnam and Taiwan and America. And as I mentioned, there are so many doctors or this webinar or the YouTube or the website are from the Vietnam, and I was invited for many times by Professor Lee Pu from Ho Chi Minh City to present and share experience with all the Vietnam plastic surgeon and all the other doctors. Yeah, I thank you very much for your attention, and I might say we are not born for one corner. The whole world is our native land. And I hope to see you someday in Taiwan, Kaohsiung. And again, Map Gang, the top gun for fat grafting.